So coming to the pathophysiology, if you see the pathophysiology, so how the ulcers are going to be formed. So because of the peptic ulcers, so these peptic ulcers occurs mainly in the gastroduodenal mucosa because of this tissue cannot withstand the digestive action of the gastric acid and pepsin. So because of the pepsin and also gastric, that is the HCl concentrations, so these are going to be damaged. So just now we discussed because of the damage of the lining of the stomach, so it won't produce the mucus. So because of the less mucus inside the stomach, so the acid is going to be damage the stomach walls. So it may give the ulcers in the stomach as well as in the stomach as well as the duodenum. So the erosion is caused by the increasing concentration or activity of the acid pepsin. So that is nothing but its HCl concentrations or decreased resistance to the mucosa. So because of the no mucosa, so no mucous membrane, and also so if the high concentration of the HCl is going to damage the walls of the stomach as well as the duodenum. A damaged mucosa cannot secrete enough mucus act as a barrier against the HCl. So if the damaged mucus, it won't release the mucus. So this mucus only protecting against from the HCl. If there is no mucus, this HCl is going to be work on the like a walls of the stomach. It's going to give the ulcers. The use of the non-steroidal inflammatory drugs inhibit the secretion of the mucus that protect the mucosa. So these drugs are going to stop the mucus formations and also damage the mucus layer. Patients with the duodenal ulcers disease secretes the more acid than the normals, whereas the patients with the gastric ulcers tend to secretes the normal or decreased level of the acids. So who are having a gastric ulcers, so the HCl concentration is maybe normal or maybe decreased. But in the duodenal ulcers, the HCl concentration is going to be high. So that is the difference between the duodenal and also gastric ulcers. And coming to the stress ulcers, so stress ulcer also is the term given to the acute mucosal ulcerations. So is and also of the duodenal or gastric area that occurs after the physiologically stressful events such as the burns, shock, or severe sepsis or multiple organ traumas. So in case of any like a sepsis, any infections or any burns, in case of any burns or any shock, or maybe is because of the secretion of the maybe high bleeding. So and also any multiple organ traumas also may chance to get the stressful ulcers. So the difference of the opinion exists as to actual cause of the mucosal ulceration in the cell ulcers. So it depends upon the causative factors are going to be, the opinions are going to be different. Usually it is preceded by the shock. So if anybody get the loss of the blood or the hypovolemic shock or maybe septic shock, any infections also may chance to get these peptic ulcers. So because of this decreasing the gastric mucosal blood flow and also esophageal reflex or the duodenum contents in the stomach. So because of the increase in acid levels in the stomach may gives the reflex and also it may gives the releasing the pepsin. So this because of the high concentration of the HCl and also pepsin, it may gives the reflex esophagus and also they may chance to get the high concentrations. So it gives that is the excessive secretions of the acid and also it may regurgitate into the esophagus. So these are the main changes in the stress ulcers. And also another pathological change, the combination of the ischemia, acid, pepsin creates an ideal climate for the ulcerations. So the physiological changes, so because of these reflexes, it is going to decrease in the blood circulations. So that means acid also going to be increased, decrease the blood circulations, and also pepsin and also high concentration of acid and pepsin. So these are all are combined together is going to create the environment for the ulceration formations. So that is the physiological changes, pathophysiological changes. So these ulcerations, so is going to give the more damage to the, especially to the mucosal walls, and also it giving the excessive amount of the secretions of the acid. So it may give the duodenogastro-esophageal reflex. So these are going to be like if any increasing the secretions, the gastric regions. So these secretions, because of the high concentration of the HCl and as pepsin, so these sphincters are going to be so because of the excessive accumulation of the acid and also this HCl, hydrochloric acid and also pepsin, so it may chance to get the regurgitate into the esophagus. So the sphincters are going to be open here. So the sphincters are open. So it's going to allowing the reflex. So these acids are going to be regurgitated into the esophagus. So that is the called as the gastroesophageal reflex disease. And also next one is the stress ulcers. So these are going to be should be distinguished from the Cushing ulcers and also curling ulcers. So these are nothing but the Cushing ulcers are the gastric and duodenal esophageal ulcers arising in the patients with intracranial injury or operations. So that means who are having some brain injuries or brain tumors. So those people are made chance to get these Cushing ulcers. And also the curling ulcers are going to be who are having some septic like a shock, or maybe in case of the burns and trauma, so multiple organ trauma may chance to get these curling ulcers. So it's going to be a proximal duodenum and also associated with the severe burn or trauma. So these are going different type of the ulcers. So it's going to give and also these curling ulcers is frequently observed about the 20 to 72 hours after the extensive burns. So if anybody exposed to the burns, so after the 72 hours, so these curlings ulcers may chance to get. So these are the pathophysiological changes of the ulcers, peptic ulcers.